Urbanization has come with many things, isn't it? Environmental part of it, and use of various products on the child, on the clothes, air fresheners, all this. So in rural areas, we see less often of the atopic dermatitis.
So ichthyosis, you will see fish-like scaly lesions on the body which are present, and it is also associated with itching, and the skin is very dry. It generally, most of the cases are confined to the feet.
It often starts subtly, an itch, a dry patch of skin that just won't go away. But for many Kenyans, what seems like a minor irritation quickly turns into a daily struggle with discomfort, inflammation, and emotional distress. These are the realities of eczema and also of ichthyosis, a lesser known but equally challenging group of skin disorders characterized by dry, scaly skin. Despite their prevalence, eczema and ichthyosis remain widely misunderstood. In Kenya, eczema is often dismissed as a simple rash, while ichthyosis is simply mistaken for severe dryness or even neglected hygiene. Both are frequently misdiagnosed or wrongly attributed to allergies, poor skincare, or cultural beliefs. Yet, for those living with them, the experience is far more complex. Constant itching, thickened or scaly skin, visible flare-ups, and the relentless need for treatment can affect not just the physical health, but also confidence, sleep, and emotional well-being. In this episode, we take a closer look at eczema and ichthyosis in our country, what causes them, how they present, and why proper diagnosis and treatment are essential. We speak to a dermatologist and a pediatrician to understand the growing awareness of this condition and explore how environmental factors, changing lifestyles, and even climate might be contributing to their rise.
My name is Dr. Anand Urhekar. I am the section head of dermatology and a consultant dermatologist at the MP Shah Hospital. Ichthyosis is a disorder of cornification in which you get persistently dry, thickened skin on the body. It is generally seen on the legs and the hands, but it can come on any part of the body. There are at least 20 varieties of ichthyosis, but we are not going to discuss all of them. We generally discuss the most common one, which is called as the ichthyosis vulgaris, which has a genetic predisposition.
Ichthyosis vulgaris is a genetic skin disorder where the skin doesn't shed off its outer layer properly, leading to a buildup of dead skin cells. This causes the skin to become dry, rough, and scaly, especially on the arms, legs, and back. In Kenya, ichthyosis is likely underdiagnosed and underreported.
It is quite common in Kenya. The cases are increasing. It is seen in children also, and it can be seen in adults also, and it can be seen in aged population also.
Eczema and ichthyosis are both skin conditions, but they differ significantly. The most common form of eczema is considered an immune-mediated reaction.
My name is Dr. Varsha Hirani. I'm a consultant pediatrician. So eczema is basically an immune-mediated reaction causing like a rash or redness on the child's skin, may get super infected with bacteria if not treated on time.
So in general, what we see in the outpatient is the eczema is an hyperlichenified skin with sometimes oozing or a secondary infection associated with it.
From recent years of experience, we are seeing it's getting quite common in our children, though we haven't come like specific numbers on how much it is. But definitely from experience, we are seeing a lot of children with atopic dermatitis recently.
Eczema is more common than ichthyosis. So lately I've been seeing a lot of cases about atopic eczema. Atopic eczema is generally seen in children. So what happens in atopic eczema is it can be present by birth, or it can be present a few months after birth, or it can be present in adulthood.
Urbanization has had a notable impact on the rising prevalence of eczema, particularly in developing countries. As more people move into cities, several environmental and lifestyle changes come into play that can increase the risk and severity of eczema.
Urbanization has come with many things, isn't it? Environmental part of it, and use of various products on the child, on the clothes, air fresheners, all this. So in rural areas, we see less often of the atopic dermatitis. Treatment, basically they use normal oils. For example, coconut oil works well in some children, not in all though.
Eczema is influenced by a combination of genetic, environmental, and immune-related risk factors.
So one of them is genetic, the kind of foods we are eating, environmental factors. So we can categorize them into food-based, environment, as I said. Yeah, the use of multiple things like softeners, perfumed-based soaps for children, our detergents. Yeah, foods will be like animal proteins, meat, eggs, dairy products like milk and nuts.
Unlike eczema, ichthyosis is primarily a genetic condition, especially in its common inherited forms, and it is not typically affected by environmental or immune factors.
So ichthyosis vulgaris is generally genetic. Somebody in the family might have had it in generations and it is transmitted through genes.
So just to clarify, let us look at the differences between ichthyosis and eczema, including how each vary in appearance.
So ichthyosis, you will see fish-like scaly lesions on the body which are present, and it is also associated with itching, and the skin is very dry. It generally, most of the cases are confined to the feet. It's not infectious, but it makes the daily living very difficult because there's continuous scaling of the skin, and you can see fish-like scales on the body, and patients are quite disturbed. There are some patients who have sleepless nights because of the itching and the dryness associated with it. Now, eczemas can be of different types. There can be a dry eczema, there can be a nummular eczema, there can be an infected eczema.
We can divide them into contact dermatitis. For example, if something touches you, some babies are born with what is called cradle cap, so seborrheic dermatitis, and each child will present in a different way.
And there can be an oozing eczema where the eczema is infected and there's pus and fluid coming out of it.
So remember, the skin gets red, it gets inflamed, there are rashes, and the child is scratching. So all that will predispose you to your skin bacteria getting inside and causing an infection. So skin breaks, basically.
Diagnosing ichthyosis goes beyond what meets the eyes. As the condition often shows up early in life, it is important to identify it early so as to start treatment as soon as possible to improve the quality of life of those affected.
So ichthyosis is a clinical diagnosis. You can see the patient, and with years of experience, or even the resident, once he has seen it in the clinic before, during his residency, he can get it. You see very dry patches, you see small triangles, or you see scaly skin. Very, very dry, and it can be picked up just like that. Biopsy can be done, but it is not required because it is a clinical diagnosis. But in childhood ichthyosis, genetic testing or prenatal testing can be done, and it can be differentiated from other disorders.
The diagnosis of eczema, particularly atopic dermatitis, is primarily clinical, meaning it is made based on a doctor's careful examination of the skin and a detailed review of the patient's medical and family history.
It is a clinical diagnosis, going through the history the child is presented with, the social history, environmental history, and then looking at the rash on the areas it has affected will guide you on what kind of dermatitis you're dealing with.
The dermatologist can see the lesion and the eczemas can be diagnosed clinically. There's no need for a biopsy to be done because these are erythematous rashes associated with oozing or itching or lichenification, and it's a clinical diagnosis. I wouldn't personally do a biopsy for an eczema because you can pick it up very easily with the eye.
Coming up after the break.
People having oozing eczemas or lichening eczemas, especially on the exposed parts of the body, or ichthyosis, there is a big social stigma. People need to be aware that these are not infectious. These are also normal individuals who unfortunately have developed this disease.
Long-term use of steroids, of course, is not advocated. So routine follow-ups, identifying the triggers, and managing symptoms.
As we close the first part of today's episode, it is clear that both eczema and ichthyosis, though different in cause and character, share a profound impact on those who live with them. Eczema, often flaring unpredictably with environmental and immune triggers, can be exhausting to manage. Ichthyosis, on the other hand, it may not itch or inflame in the same way, but its persistent dryness, scaling, and the emotional toll of a lifelong condition are equally significant. Both require more than just medical treatment. They call for understanding, support, and a shift in how we view skin health in our communities. In a world where urbanization and modern living continue to shape our bodies in unseen ways, these skin conditions are silent reminders of the delicate balance between nature, nurture, and health. After the break, we return for a one-on-one conversation with our dermatologist. Stay with us. And now for a short healthcare tip. If you or your loved one is living with eczema, one of the most important things you can do is protect and strengthen the skin barrier. Start by using a gentle fragrance-free moisturizer multiple times a day, especially after bathing, to lock in moisture and prevent dryness. Avoid hot showers and harsh soaps that strip the skin of its natural oils. Try to identify and reduce exposure to your personal triggers, whether it's certain fabrics, detergents, dust, or even emotional stress. Involve your doctor in creating a treatment plan that may include topical medications, antihistamines, or allergy testing when necessary. And don't forget, managing eczema is not just about treating flare-ups, it is about consistency, patience, and care every single day.
We are living in a lost and broken world, constantly bombarded by messages of hate and atrocities. But with God, we can overcome. Find hope and restoration on the go through life-changing shows on the Family Media app.
And then you will lose yourself and gain the world. And Jesus said, what good is it?
Get to stream Family TV and Family Radio 316 straight from your phone. Catch up on a show you missed or create video streaming playlists by saving and watching videos from our huge variety of shows at your own convenience. Download the Family Media app, available for all Android and iOS users on the Google Play Store and Apple Store respectively. Family Media, keeping Jesus on the airwaves.
Welcome back. Before the break, we examined the causes, symptoms, and differences between eczema and ichthyosis, setting the stage for a deeper understanding of these complex skin conditions. In the next part, we speak to Dr. Anand as he takes us further into the world of diagnosis, treatment, and long-term management. From these clinical insights, we continue to unpack what it really takes to care for the skin and why awareness and early intervention can make all the difference.
Is there a place for natural remedies, like for instance shea butter in babies? Sometimes I hear mothers saying that they want to use that.
Now see, the mainstay of therapy is emollients. So, there are certain emollients to which the babies are allergic to. So shea butter is also a type of an emollient. It keeps it supple, moist, hydrated. So in some cases it can be used, but not in all cases, because there are certain children who are allergic even to emollients. So what do you do now? There's no option left. So yeah, shea butter can be tried. There are other some herbal medications which I do not promote myself because I am an allopathic doctor, and this question should be answered properly. I mean, the herbalist can answer this question properly. But yes, in my practice for about 25 years, I have seen patients using shea butter on babies. Yes.
For mothers who notice their babies have got that skin condition, how soon should they visit a dermatologist? Because I know some of them will go around to the chemist, to friends for a long time before they actually see a professional.
Yeah, so a lot of people try to self-treat the patient at home, or they go to the chemist, or they use the internet for searching out remedies, but I don't think this is a right approach to it, because what will happen is, if by chance you use the wrong medicine, then the eczema can get aggravated, and especially in babies, the treatment has to be started promptly, so that once the treatment is started, the eczema can come under control. So please do not go on the internet and do searches. Please visit the dermatologist or the nearby doctor who can refer you to a dermatologist, and then the specific treatment for that individual can be started.
A lot of the times you see people saying, stop dairy, stop this, stop that, because the skin might improve. How valid are those things, and do they apply to everybody?
So there's a big question mark regarding dairy products, whether they can be used in eczema or not. The best way to find out is to do a comprehensive allergy test. Of course, newborn babies and toddlers, they can't go to do an allergy test, but a grown-up infant or school-going infant can undergo an allergy test and see to which specific allergens the child is allergic to, and then that can be stopped, because the child is growing, the child also needs a proper nutrition to grow. So by stopping this, stopping that, the child's growth can be hampered. So it is better to do an allergy test. And there are two types of allergy tests. One is through the blood, which we do here at the MP Hospital. It's called as a comprehensive allergy test. It does not cover all the allergens, but most day-to-day common allergens are covered. Then there is a skin prick test, in which with a small needle the skin is pricked and a small amount of allergen is placed on it, and they observe the reaction to that allergen. If it becomes red, erythematous, or it flares up, then you are allergic to that. But yes, in small babies, I don't recommend an allergy test, but if the child is decent grown enough, then allergy test does help in sorting out a lot of efforts. Otherwise, because we do not know what the patient is allergic to exactly.
People who have like a lot of widespread, for instance, eczema or ichthyosis, do they face stigma?
Yeah, it's people having oozing eczemas or lightening eczemas, especially on the exposed parts of the body, or ichthyosis, there is a big social stigma. People need to be aware that these are not infectious. These are also normal individuals who unfortunately have developed this disease, and the social stigma should not be there. Even if you touch the patient, you are not going to get it. So you can be friendly with the patient and treat him like a normal, healthy individual. Unfortunately, it is not happening in the society, and people are not aware. People think he might get it or she might get it, but that's not the truth. You need to be very social and lovable with these patients.
Though ichthyosis is a lifelong condition, it doesn't mean living with constant discomfort. With the right medical approach and daily care, its symptoms can be managed effectively, offering relief, dignity, and a better quality of life for those affected.
It can be treated and cured to a certain extent. So what I mean by this is that it can be controlled, it cannot be cured completely. Depending upon the severity of the disease, the treatment needs to be chosen.
Treatment of ichthyosis begins with daily bathing to hydrate the skin and gently loosen the thickened layers. This is followed by the generous application of rich moisturizers to seal in moisture and reduce scaling. In some cases, doctors may also recommend chemical exfoliants and more targeted medical treatments depending on the severity and type of ichthyosis. With consistency and proper care, the skin gradually becomes softer, more supple, and significantly more comfortable to live in. How is eczema treated?
So moisturizing is very important, ensuring that the skin is always moisturized, use of antihistamines to prevent the itchiness, use of creams now, so like steroid creams, immunomodulator creams, that will depend on how severe the infection is. Use of soaps, which are anti-allergic to the child. So treatment is individualized to the child who comes to you, and it's not standard.
In babies and in adults, the first line of treatment is topical steroids and emollients. And if the eczema is severe, a dose of oral steroids can be given. There are some cases in which biologicals have been used, and they are being used right now. So biologicals are newly developed medications in which it is given IV or intravenously, and they have, or subcutaneously, and they have to be monitored while giving, and they give a good remission. The remission is there for about 6 to 8 months. There is a new drug called as which is steroid free. It is being still investigated. They have not brought it into the market yet, but in the Western countries it is available.
Now, steroids can be overused in eczema, and this can lead to a condition known as topical steroid overuse or steroid withdrawal.
Long-term use of steroids, of course, is not advocated. So routine follow-ups, identifying the triggers, and managing symptoms is what is the most important, instead of just going to buy over-the-counter steroid and applying, because the rash will clear when you apply and then it comes back when you stop.
Topical steroids have to be used intermittently. As soon as the flare-up goes down, you need to stop the topical steroids and continue with the emollients.
It may not. I think it will depend on the child. Yeah, we have seen some children who outgrow the allergies after sensitizing again. Some don't. Depends on how strong the genetic factor is in those cases, which doesn't go away.
When the child becomes around 13-14 years of age, there is a high possibility it can disappear. If it goes into adulthood, then there will be remissions and exacerbations. Some do come out of it, some do not. So we cannot predict it. It depends on the body's response.
Children with eczema often face stigma due to visible skin symptoms, which may lead to isolation. Educating peers, teachers, and parents about eczema being non-contagious and manageable can help reduce stigma and foster a more supportive environment.
Children do get stigmatized when they see rash. They miss school days. They might be bullying in school. The appearance of the skin, coarseness or dryness, marks on the skin, definitely it does.
Diet can play a supportive role in managing eczema, especially when specific foods trigger flare-ups. However, dietary changes should always be guided by a doctor or nutritionist to avoid unnecessary restrictions and ensure balanced nutrition.
Yeah, diet can play a role in the management of eczema, because if there are certain things in which the patient is dietary, like milk or meat or eggs or something, then those things need to be avoided, and other dietary supplements need to be taken so that it is not aggravated.
Allergy testing can play a helpful role in managing eczema, especially in identifying potential triggers that may be worsening flare-ups. By using tests such as skin prick tests or blood tests, doctors can determine whether a person has allergic sensitivities that might be contributing to their eczema symptoms.
Sometimes, if the child is a bit older, we may also do allergy tests to guide us on what the child is allergic to. So food or environment. Because what most of the time it happens is we are only treating what is on the skin, but we are not giving information on what are the triggers. So discussing triggers with this family or the parents helps us to know, stop this, we see, stop this, we see.
If the eczema has an etiology of an allergic component, then a comprehensive allergy test is needed. and in which we can determine the allergens to which the child or the adult is allergic to.
When I get a new patient who's coming to me, it literally takes a lot of time to explain what it is, what the triggers could be, and sometimes they're actually surprised that you're saying this may be triggering because they never thought about it.
Awareness of eczema in Kenya is improving, especially in urban areas, but many challenges remain, particularly in rural regions where access to scientists is limited. Cultural misconceptions often lead to stigma, affecting patients' social lives and treatment choices.
Those mothers have literally used everything by the time they're coming to you. But when you open up and discuss, they actually understand where they went wrong. Use of some products, what was not needed. Some products were triggering the rash, all right? The way they were applying the moisturizer is also important because most of the time we tend to rub on the skin, which will come more to your hands and not the child's or the adult you're putting on. So tapping is a good way to apply the moisturizers or the creams generally.
Now there is a lot of awareness among people about these diseases because they can be frequently seen, and people are reading about it, and now with this program also on your television, I think people will know more and more about it.
As we close today's episode, it is clear that both eczema and ichthyosis are more than just skin conditions. They are complex challenges that affect millions of lives in deeply personal ways. While eczema often comes and goes, requiring ongoing management and care, ichthyosis reminds us of the importance of patience and consistency in treatment to ease its lifelong impact. Awareness and understanding remain crucial, not only among our healthcare professionals, but also within communities to break down stigma and ensure that everyone affected can access the support and treatments they need. With advances in medicine, from targeted therapies to improved skincare routines, there is hope for better quality of life and greater comfort for those living with these conditions. Yet, the journey doesn't end with treatment alone. It involves education, empathy, and a commitment to creating an environment where people with skin disorders are met with kindness, not judgment. Thank you for joining us as we explored these conditions in depth. Stay informed, stay compassionate, and remember that healthy skin is an important part of overall well-being.